So as we've been saying for weeks now, the rise in the number of COVID-19 infections poses a big challenge for healthcare providers. Let's talk now about what medical schemes are doing to help their members and mitigate the impact of the pandemic. Bring in Katlego Mothudi. He's Managing Director with the Board of Healthcare Funders. Katlego, a very good afternoon to you. Thank you for speaking to us. So our conversation, of course, comes after that statement from the Council for Medical Schemes, which says only 19 medical schemes have applied for exemptions for their members. Those who do not cover some 4 million South Africans. What is the risk of that lack of cover or those exemptions?
Let me first explain what the exemptions are about. Earlier on, during the pandemic, we approached the Council for Medical Scheme and asked that they consider some measures to make it easy for schemes to cater for their members. One of those was the issue of a payment holiday, and we asked that they consider a blanket exemption. And their statement subsequently was that they would rather have schemes approach them on a case-by-case basis. And the schemes that responded are those that I mentioned, but it does not mean that the schemes that did not apply for this exemption did not find measures within their own rules to make provision for this, and at least this. The issue of a payment holiday, some schemes have offered their members. Other schemes have provided, or rather approached, the pay points where these members are employed to cover more than their usual subscription that they pay for. And other schemes have decided that mid-year they could allow members to downgrade their options, something that is usually offered once a year. Those are some of the measures that the schemes have made to make sure that there isn't much financial harm to their members.
And what allows them to be able to offer that sort of assistance without the exemptions, which are seen, I suppose, from what we're reading as the much more preferred way, if you will, of trying to mitigate the risk and make sure there is cover and that the companies themselves remain sustainable and financially viable?
The way schemes function is that they are guided by the Medical Schemes Act, but the registrar in the Medical Schemes Act empowers the schemes first to appoint board of trustees and also draft scheme rules. Now, these scheme rules will differ from one scheme to another. There will be some schemes who will, within their own rules, be able to allow the trustees to pass a resolution that would allow them to do this measure. So not every intervention would have to go towards the council. It is only limited to what is contained in the scheme rule. The council offers exemptions against prescripts of the Medical Schemes Act, but not as far as the scheme rules are concerned.
I hear what you're saying, but in some of the articles published since that CMS report came out, just one of them I want to read for you says medical schemes that provide around half of South Africans with medical cover, quote, seem not to be acting in their best interest. That's according to the Council for Medical Schemes. And you say today that that is not true.
Yeah, that is not necessarily true. So the way the registrar and the Council for Medical Schemes provide oversights to schemes, they obviously make sure that there is compliance to the Act. The registrar as well is empowered by the Act to ask for certain reports, not limited to financial statements from the schemes. So I think it would be important for these reports to be requested from the schemes to actually indicate what schemes have done. And I am aware that a lot of schemes have asked their trustees to pass these resolutions that allow them to give members this much needed relief.
So it's your word today that these medical aid schemes that don't have the exemptions cover about 4 million people, we're reading. All of those 4 million people are still covered and none of them have been denied any rights or access to the schemes.
Obviously, it will differ from one scheme to another because of the profile. And also within one scheme, you will not have the same solution for people. And I can give examples. If, for example, a person who is self-funded, not linked to a provider giving part of their subscription, they could actually write to the scheme and say, I have an employment situation, what can I do? If their plan, for example, has got a savings account, there are some schemes who've said we can utilize the balance in your savings account to actually fund it. Some members have been allowed to apply for what we call ex gratia benefits, and here they would have to demonstrate that they are indeed in financial distress, and then that would be covered as part of their ex gratia. So the methods vary, and they even vary within the scheme, because not one beneficiary would have the same financial hardships or as the other one. And there are those that have said you can downgrade. If you're on the topmost option, downgrading to the lowermost option will actually probably afford you to pay a fraction of what you would normally pay. The good thing is that because the council has declared COVID-19 what we call a prescribed minimum benefit, any cost that is deemed to be medically necessary arising from a COVID-19 diagnosis will actually be covered in full.
But as things stand then, it is likely that there might be instances where medical aids are falling foul of that, so you cannot say with certainty that it is not happening.
So the medical aid industry is tightly regulated, and what I would have expected is that if there is any doubt whether schemes are falling foul of providing access to members, it is easy for the registrar to actually ask for reports to do that. And secondly, the registrar is empowered, according to the Medical Schemes Act, to actually inspect the schemes. I think what made us uncomfortable was that there was this supposition without actually asking the schemes, what have you done in detail for your member? And I'm detailing all these various elements that are definitely in place.
Katlego Mothudi, Managing Director for the Board of Healthcare Funders, thank you so much for your time this afternoon.